Hi, I'm Dr. Sassy. If you're thinking about removing your lap band, you may have questions about how safe it is. Laparoscopic band removal is a very common and usually safe procedure. It uses small incisions and a camera to gently take the band out. While it's called minimally invasive, like any surgery, there are still some risks. But the good news is that complications like infection or bleeding are rare, and most people go home the same day or the next. During surgery, we make tiny cuts in the belly and use special tools to carefully go around any scar tissue and take out the band. Sometimes, if the band caused damage inside, we fix that during the same surgery. It's normal to feel some pain or bloating right after, and you'll start with clear liquids and move to soft foods. If the band caused long-term problems, we may help you plan your next steps, like moving toward another weight loss surgery that's more effective. If you're unsure, talk with a bariatric specialist. We'll help you feel better and stay healthy.